Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a wonderful start to your day. We appreciate you guys coming on, and it's always nice when you say hello, and we try to say hello back to our audience. We do a little roll call to show you our love, and you're showing love to us. We appreciate it. And let's see here if I can see as you guys are getting your notifications. Let's see here. Okay. There we go. I got mine. Well, good morning, everyone. There, see? I got my notifications on my wife's phone. Okay, let's say hello to Elena, you're number one. Madeleine, Kippawa, Quebec. Natalie, Karen from Peterborough, Rain Cloud, Michigan. Nick from our staff, Sandy from Fergus Falls, Minnesota. Grace from Newfoundland. Judy, New Brunswick. Janine, how are you? Bonnie, Little Britain. Sandy, Vancouver, Washington. Diane, LaSalle. Natalie, Marl from Ottawa. You get bonjour, Hearst, Ontario. Rose, good morning from Brampton. Brandon is saying hello too. Hi, Brandon. Donna, how are you from Park Hill? Helga, Marilyn from Charlottetown. Rosa from La Belle Ville de Montréal. Dennis, Doc McEwen, our dear friend from West Tennessee. Wanda from Virginia. Marlene. I don't know if this is another Natalie or the same one I said hello to. I don't know. Yvonne, Petawawa. Shirley from beautiful Twin Gate, Newfoundland. Mary, Gary, Yolande, bonjour. Danny, Anna, Marianne, how are you from London? Darlene, Maureen, how are you, Maureen, from Boca Raton? Carol, Brahim. I always get a kick, Brahim, because when you're not number one, there's a problem. Kevin said I missed the first 5. Sue, Dorothy, Gwen, Dale, Shauna, Faye, Nativity. What are you saying, Nativity? I missed all of you guys at the top. Sue, how are you? Cheryl from West Virginia. Sully from Petawawa. Carol from West Virginia. Okay, let's get going. Guys, if I miss you at the top, that's not my fault. Guys, it's Facebook. I don't know. You know me. I hate to touch anything differently because if I do, I'm in trouble. Carmel is asking about polymyalgia rheumatica. Okay? Arthritica. Poly means everywhere. Okay? Multiple places. So you get, and this is often comes in an acute attack, a severe inflammation, pain. I remember patients coming into the office and they couldn't unbutton their shirt. Lift your arms. Had trouble lifting their arms. They couldn't get their arms over their head with polymyalgia, either rheumatica or arthritica. It's autoimmune. A lot of times after a virus, and I go after it from an inflammatory perspective. First of all, anything autoimmune is leaky gut. Probiotics. Don't feed the bears. No sugar. And I love the combination of Navital, curcumin, vitamin D. Vitamin D is very anti-inflammatory, guys. And I used to have patients with polymyalgia rheumatica because I always found they were low in vitamin D. I would personally have them on 10. I do the hammer with them actually. Okay, 20 to 50,000 IUs for 3 days. And then I'd bring it down to about 10 IUs, 10,000 IUs. So that's, Carmel, what I recommend. John, my wife has bronchitis and emphysema, okay? And what's the question here? 3 months ago, her oxygen is going down. You're on Navitol now. I like that. I would add with the lungs, vitamin D, get her levels, because I'm telling you, it's a big factor. And then the other thing that I recommend, especially with lungs, is quercetin. So you might add that, John, to the regimen, okay? Shelley, what is Dr. Martin's protocol for someone who just had a mild heart attack? Well, I would have, let me give you the reasons why I'm going to say this. I'd have them on Navitol. Why? Opens up blood vessels. Nitric oxide, okay? You hear about it on the TV or whatever. Beets, okay? A supplement of beets to open up nitric oxide. While Navitol is much more powerful than that. So I love that. Pine bark extract. Famous for it. And plus, it's an antioxidant. It protects the blood vessels from further damage. I'd have them on high DHA. Lubricate. And DHA is the best lubrication. Anti-inflammatory too, of course. But it lubricates the blood vessels. So that combination, curcumin you could use too. I like curcumin. But that's the big thing. Okay, Shelley? And food. Get off the sugar. Sugar elevates your triglycerides and lowers your HDL. Eggs, meat, and cheese. Cecile. Nurse took my stethoscope on my right neck, heard a murmur. She says I have high blood cholesterol. Your triglycerides, 1.27, not bad. HDL, 2.5, better. Okay, so your blood pressure is high. Well, 190, yeah, look, your first number, I don't care about as much. I'm not saying I don't look at it. But I'm more interested in what your second number. You're not showing me you're over 80. And anyway, it's hard for me to give specific medical advice when you're not my patient. I'm just talking in generalities, okay? She told me I have thickening of the heart lining. You're 84 years old. Possible. How would they find that out? Either through an MRI of the heart, ultrasound. They do calcium artery tests now, and CAC, coronary artery calcium test, okay, what it is. And they might want to do that to have a look at the amount of calcium in around the heart. Marissa is Hi, Dr. Martin. Well, hello to you. Is coconut water good to drink every day? Well, it's an electrolyte drink. I have no issue with, and if it's real coconut water, nothing added. Okay? Real coconut water, nothing added. And it has some natural sugars in it. I got no problem. As an electrolyte drink, it's a good electrolyte drink. Yeah, I got no problem with it. I know it has natural sugar in it. Don't live on it, but as an electrolyte, I like it. Okay, Gloria, what do you think of dental implants for somebody who had cancer and is in remission? Well, listen, I'm not worried about like the dental implant. Like, look, orally, here's what you do. Here's what you do. Okay? Keep care orally. The best thing, take probiotics internally, those bacteria, different strains, go to different places. That helps you. Anything you are exposed to, like we live in a world, if you think you're getting away from it, good luck. Okay? So, the dentist, I mean, what are they doing with implants? Are they caps? Are they taking all your teeth out and putting in implants? But orally, good bacteria, probiotics, oil of oregano. Nothing better orally than that. Okay? Take care of that. Thank you very much. And that was Gloria. Rafaela, how are you? I would like to ask Dr. Martin for his advice. His friend has got prostate cancer. Okay? If yes, could he write the dosage for Europe, as he won't know how to convert them? Rafaela, send me that email. Okay? Again, if you don't mind. Because if you want specific doses, maybe I could do it. Okay, so they got prostate cancer, right doses for Europe. Okay, because they can't get our product. Okay, that's what I mean. How much DHA would you recommend? I'd recommend, like, to shrink a tumor, the DHA, our high DHA has almost 3,000 milligrams of DHA in 2 capsules. I do about 6,000, if they can, milligrams of DHA, specifically DHA, a day for tumors. Okay? What else do I want? I want curcumin, about 1,000 milligrams of curcumin a day. I would have them on vitamin D, 10,000 IUs a day of vitamin D. Always get their vitamin D levels checked, because for prostate cancer, let me just show you, because I talked about this the other day. Okay, so in Europe, make sure for cancer, get your blood work up to vitamin D, your dehydroxy, 60 to 80 ng/ml. Hope you got a pen. And in NMOL-L, not dash, whatever that is there. 150 to 200 minimum. Okay? 150 to 200 NMOL or 60 to 80 ng/ml. Okay. Merci pour les questions. And probiotics, tell them to take lots. Francis, cataract surgery. Okay. What's the question? But I wonder what Dr. Martin thinks of this blurriness and fogginess 6 weeks after surgery. That's possible. I've seen that happen. Look, Francis, just stay on what you need to stay on. What's the best thing for your eyes? Navitol, pine bark extract, opens the blood vessels, protects the blood vessels. DHA, okay, what does it do? Anti-inflammatory, lubricates those blood vessels in behind the eyes. I showed thousands of patients with that combination of DHA and Navitol, pine bark, combine them for eyes, okay? Could take a while. I don't know what you're on. But make sure you're on that for regeneration, Francis. Okay? Caroline, can you discuss causes and solutions for low blood pressure? Well, causes, okay, of low blood pressure, anemia can cause low blood pressure. Thyroid issues can cause low blood pressure. You got to find out, like, what's causing that. And a lot of times, they were low in B12. They were borderline anemic. Or their thyroid had slowed to a crawl and their blood pressure had gone down. Okay? So those are the things I look for. Fix those things. Okay? Thanks, Caroline. Martin, I like your name. I would like to know to help my 14-year-old daughter with very bad acne. Okay, I used to, oh boy. In my practice days, boy, young people loved me because I showed them how to fix their acne. Okay? Here's why. Okay? They get acne. Hormones, 1. Leaky gut, 2. Guaranteed. Fix the leaky gut. They usually have a lot of fungus. I know they want the antibacterial soaps and all that. I don't like that stuff. I never have. I never have because it's not getting at the root cause. Too much estrogen, okay? Too much estrogen, not enough progesterone, estrogen dominance. They often get, I don't know if she has PCOS or not, polycystic ovarian, but a lot of times that estrogen drives that because that in a woman will elevate her testosterone. Dim it out. So I would have that young, and I get great results. By the way, no sugar, don't feed the bears. Probiotic, broad spectrum. Ours are coming to a theater near you. I just got word. They're coming back. Oh, man, oh, man. I've had a migraine for how long? We haven't had them? A month or more? I've had a migraine. Drives me crazy. Anyway, those strains, hard to get, but it's coming. Okay? Ooh. Probiotic. Okay? I'd have her on bone broth. Why? Because it regenerates the gut. It really makes a difference in that. Okay? I'd have her on oil of oregano. She can do that right on her skin. You can do it internally and externally. That's what I would do. Thank you very much. And that was Martin. I really like that name. Rebecca, how are you? Did Dr. Martin know about acute confusion migraines, usually in kids? Are they associated with long-term diabetes or cardiovascular disease? No, well, I'm trying to see the connection. Look, usually with migraines, okay, any kind of migraine, usually, okay, here's what I saw. Because I always look for deficiencies, okay, in migraines. 1, they were low, usually low in magnesium. 2, they usually were low in B12. 3, oftentimes low in vitamin D. That's what I saw in migraines. And a lot of times estrogen dominance, too much estrogen. So I'd block that out with dim it out, flax seeds. Often, they were dehydrated a lot of times. Oh, Dr. Martin, I drink water. Yeah, but you need more salt than that water. You need some electrolytes. And, and magnesium. So I would put them on magnesium. Associated with long-term diabetes. I got to look it up. I mean, I'm trying to think of what the connection, you know me, I always connect things to insulin, So possibly, okay, possibly. Shelley, I think I just mentioned that. How much Navital would Dr. Martin suggest for someone who had a heart attack? I would be doing, with a heart attack, I would be doing 4 Navital a day. Do it for at least a month, maybe 2 months, to help heal. And DHA. Flo, how do you feel about dandelion root extract? I like it. I've seen some good studies on dandelions. My father-in-law, he used to have a dandelion salad. Okay, my father-in-law, Italian. And he liked dandelions. And I said, I'm not eating that stuff. Are you kidding me? Salad, dandelion. But there's some good studies on dandelion, and I got no problem with it. If you want to have that, go for it. Okay. I like pine bark extract better. That's me. I just got much more flow experience with that. But I got no problem with dandelion root. Mary, I'm sleep deprived. Poor you. You and millions of others. Cortisol in control, okay, improved. But you're not there yet. Can iodine make, okay, so, okay. I'm on 2 types of meds and my blood pressure has not changed. 169 over 95. 95 is high. That's definitely high blood pressure. If it hasn't changed on meds, I don't know what to tell you. Can iodine make your blood pressure go high? No, not really. Mary, I'm just trying to figure out. You've changed your diet, of course. Do they reset? Look, sleep deprived. I mean, you know, and you're already on cortisol. Maybe try upping that a little bit more. That'll help your blood pressure too. Cheryl, I take 4 magnesium in the evening to help me sleep. Well, that's quite a bit. But I cannot take the cortisol control. I feel sorry for you. But, hey, you can't. What can I tell you? Should I take more magnesium? Well, you could try it, Cheryl. Listen, for magnesium, you're already getting, I don't know if it's our magnesium. What kind of magnesium? You taking citrate or biglycinate? Biglycinate. I don't even know how to pronounce it. Take more. Well, look, magnesium not going to hurt you. The only, sometimes with citrate, you get a loose stool. Like you're not going to overdose on magnesium. Cheryl, I would have a look at yours. Find out what your vitamin D levels are too. It's a big factor because without vitamin D, at a good dosage, your body's not producing enough melatonin. And I would say that to Mary too. Like, check your vitamin D levels. Find out. They need to be optimized. Brenda's talking about her eyes. She's having cataract surgery in 3 months. And you seem to be doing everything. You're taking DHA. Are you? Yeah. Oh, yeah, you're taking lots. You're taking everything. You're asking me whether I should have 1 eye done or 2. Well, you don't have any vision deficiencies in the left. It's hard for me to tell you, Brenda, you know, if you've opted for 1, that's nothing wrong with that. I don't see any big issue with that. You're doing everything I would do as far as your eye health. I mean, really. I like what you're doing. Okay? You should do very well with this surgery. You might not need it in the other eye. Okay, Lois is asking about her voice. It has changed significantly. Okay? And they checked her vocal cords, apparently. Wait a minute. I had a scope and it came back clear. Okay, so they did. They checked your vocal cords. Sinus can have an effect on that. Postnasal drip. Did they scope your stomach to see if you had a silent acid reflux? Because that can affect your voice. Okay? Where you get that. So I would have you on, Lois, digestive enzymes for your stomach. Good for you anyways. And probiotics for this. And because I don't know, like in case you do have post-nasal drip, I love probiotics and oil of oregano. Florence, a friend was diagnosed with osteoporosis, okay, and prescribed vitamin D in a gel form. Will this be as effective as liquid? Well, not unless it has K2 in it. See, our vitamin D, okay, I got a bottle right here. It's vitamin D3 with K2. And K2 is important because it takes calcium and puts it in the bones. So with osteoporosis, vitamin D is great, but you want K2 with it to bring it to the bones. Get it to its intended destination. That's very important. So I don't know what kind of gel they're on. I know it's vitamin D, but is there K2 in it? I don't know. You tell me. Dinah, I'm on vacation. Well, lucky you. And swimming in salt water. Do I still need to take magnesium? Well, they're not really magnesium salts in seawater. Now, seawater is very good for you. Like, you're on vacation and you're in the ocean. Beautiful. Okay? It's so good for you. The vitamin D from that sun is so good for you. And you're topping up your vitamin D. No. Magnesium, well, you're not really bathing in magnesium. If you were in a hot bath with Epsom salts, that would be magnesium. Okay? So, do I still, if you got your magnesium with you, take it. It's good for you. Okay. Georgia. Why does someone get heart palpitations? What to do about them? Well, a couple of things could do it. Cortisol can do it. Okay, stress hormone. That can give you heart palpitations, possible. Low levels of B12 can give you a heart palpitation. Low levels of magnesium can give you a heart palpitation. Low levels of CoQ10, you're not eating enough steak, can give you a palpitation. So, there's a checklist there. And that's what I usually would look for. I go through that checklist with in the office. So, okay, Flo, if humans weren't designed to eat carbs, okay? I love it, Flo. Why was there fruit in the Garden of Eden? Okay, this is good. I like your question, okay? Now, okay, I've been studying my Bible for 40 years, more, okay? So I'm just going to give you a little take, okay? Combining nutrition and the Bible, okay? So the Garden of Eden, okay? And by the way, they were told, see that tree over there? Don't touch it, okay? The fruit there, Don't touch it. Was it an apple? I don't know. Okay? Don't matter. Okay? Look, your body was designed, and remember too, okay, Adam and Eve, they were designed to live forever. So they weren't ever going to get sick as long as they obeyed God. Okay? So that's, look, I don't want to get into it too much, but that's what the Bible says. And they disobeyed, and then their bodies changed. Okay? Their bodies changed. They were never going to get sick. They were never going to die. Now they get sick and they die. Now, again, go through the genealogies, and until the flood, man lived like Methuselah lived till he was 969 years old. Okay? So it's different. And the body, your body, was made to eat meat. I always prove that. It doesn't mean you can't have fruits and vegetables, by the way. I never said that. But your body was designed for meat. The length of your colon, the acidity in your stomach, the fact that you don't have 4 stomachs like a cow, like I try and prove that all the time, that man was made. Your acidity in your stomach is more acidic than a lion's acidity. So you were designed to eat meat. Originally, I don't know. Did anatomy change because of the fall? I think so. Because you don't live till you're 969 years old anymore. Right? It went, by the way, from very high numbers to post-flood, 120 years, and then 70. Okay? That's 70. And with grace, 80. So that's just the history and the genealogy I'm giving you. But your body was designed for meat. Your teeth, see these? They're meant for you to eat meat. Okay? Eggs, meat, and cheese. And you can have some fruits. I didn't tell you couldn't eat fruit. I just don't want you to live on fruit. Because you weren't designed to live on it. Okay? You weren't designed to live on it. So, you can eat it. I like berries. It's not an apple a day keeps the doctor away. It's a steak a day keeps the doctor away. But you can have an apple. You want to have an orange? Eat it. Don't drink it. So I'm very consistent. Okay? Now, for 30 days on the reset, that's a different puppy. And I got a reason for that. Because if you have metabolic syndrome, and you're in the 93% of the population that have some form of metabolic syndrome, you got trouble with insulin. And therefore, and your cells at the cellular level are resisting insulin, I'm out to fix that. And I've proven it, that if you do a 30-day program, you change your resistance at the cellular level to insulin. What does that do? Lowers inflammation, lowers the amount of insulin that you need. It reshapes and empties your liver. It's good for everything, from your brain to your toes, from your joints to your nose. Does that rhyme? But, so I love the question, okay? Because, guys, I want you to think. I want you to know your anatomy even, to the extent that you should know it. And even your, what you can't see, like your stomach. It was designed. You don't need that kind of acidity, like at 1.5 or whatever acidity, if you are eating fruits and vegetables. You don't need that. What you do need is a long colon and 4 stomachs. And you need an enzyme called cellulase. You don't have it, okay? If you're living on fruits and vegetables. I know many people do. They think they're doing the right thing. I push back on that. I always have, and I always will. Okay? I always push back on that. You can have them, but don't live on them. That's what I tell people. Okay? You want to have some vegetables? Hey, go for it. But don't tell me that broccoli is better than steak, because that ain't true. Okay? Don't tell me that salad is better than eggs, because that's not true. Don't tell me any vegetable you can name is better than eggs, meat, and cheese, because it's not. Not nutritionally, it isn't. Again? So, that's what I'm saying. Flo, I love you. Thanks for the questions. Okay, can we, I want to see if I can get through this. Let's get through with it, because I only got 3 more. Janine, would my husband recommend, he wants to gain some weight, okay? Most people want to lose weight, but your husband, and he's 84. Give him a high five for me, because you say he's in good shape, but he can't gain weight. Well, why does he want to gain weight? Because he's very tiny, right? Yeah, but you don't want to just put on fat for the sake of fat. Now, 3% milk, that's not fat enough. Tell him to drink cream. But I don't want him to get fat for the sake of fat. I want him to build muscle. What he needs to be concerned with is staying strong. Because muscle is the driver. It keeps you moving, and the stronger you are, I don't care so much about weight. I really don't. Strength. Does he have good grip strength? He's in good shape at 84. Can he get off the ground? If he's on the floor, can he get up by himself? He's in tremendous shape. So, again, don't be desperate to put on, throw the scale away. Who cares? Get strong. That's me, okay? And I'm right about that, by the way. Okay? He shouldn't be desperate to gain weight. Why is he desperate? Tell him to get strong. Okay? Janine, thanks for the question. We love you dearly. June, my doctor said that my cholesterol is too high. Okay. And wants to give me pills. Okay. And you said no. Okay. I like you, June. Then he mentioned my A1C is 6.5. That's too high. You and carbs, June, don't get along. So lay off. Okay? And you say you're doing all right, but you're eating too many carbs. Okay? Get your A1C down. You eat a lot of egg, meat, and cheese. You got to eat more eggs, meat, and cheese and less carbohydrate. You're not processing them. But if you're feeling good, I don't sleep well. That can be a factor. Sleep is so important, isn't it? Okay? A lot of people don't sleep well. 70-80% of the population never get into that deep sleep. Okay? I was ready for a low dose of metformin. I don't know. It depends, June, how you're feeling. I mean, you know me. I love A1C. I find it to be the best test. You have insulin resistance. I'm not big on medication, but you want to try it? You make sure you're taking B12 if you're on metformin, because you're not gonna be able to assimilate B12. Okay. Thanks, June. One more question. Is it possible to reduce eye pressure? Yes. It's the last question. Oh, by the way, who was that? That was Judy. Yes. Navital, DHA. Because the pressure has to do with blood supply. Always, always look to blood supply. So blood vessels behind the eye, open them up and lubricate them. And it's amazing what happens inside the eye, including reduced pressure. Thank you for all those questions. Guys, we got through them. That means Monday's not Q&A. Unless you send me a pile of questions over the weekend. Okay. No, but hey, we really appreciate you guys more than you know. And what else did I want to say? Okay. Yeah, we love you dearly, and we'll talk to you soon.